Welcome to our yoga class. So normally in yoga we focus on the form, but today we're focusing on the glenohumeral joint.
The glenohumeral or shoulder joint is a multi-axial ball and socket joint responsible for connecting the upper extremity to the trunk. It is said to be the most mobile and least stable joint in the body, allowing movements of abduction, adduction, flexion, extension, circumduction, and rotation. The articulation of the humerus with the scapular bones forms the joint. The humerus is surrounded by a number of muscles and ligaments which attach at bony landmarks. Proximally to distally, these include the lesser tubercle, the anatomical neck, the bicipital groove, and the deltoid tuberosity. The head of the humerus sits in the glenoid cavity of the scapula. The surface is extended by the glenoid labrum. The coracoid process is another site of attachment that projects from the anterior surface of the scapula.
The joint capsule of the shoulder contains a number of important features which function to stabilize the joint. The fibrous capsule attaches medially to the scapula and laterally to the head of the humerus. The synovial membrane lines the inner surface of the joint capsule. The subscapular, infraspinatus, and subacromial bursa are distributed accordingly throughout the joint capsule and act to reduce friction in the shoulder joint. On its own, the fibrous capsule is too weak to adequately support the shoulder joint. Therefore, the stabilization of the shoulder joint comes primarily from three ligaments and their surrounding musculature. The glenohumeral ligaments are three fibrous bands located on the anterior side of the shoulder joint. Each of the superior, middle, and inferior glenohumeral ligaments plays a different role in stabilizing the head of the humerus depending on the arm position and the degree of rotation. The coracohumeral ligament extends from the coracoid process of the scapula to the anatomical neck of the humerus. The transverse humeral ligament serves to keep the tendon of the long head biceps brachii in the bicipital groove. Additionally, the glenoid labrum is a fibro-cartilaginous rim attached to the margins of the glenoid cavity. The labrum serves to deepen the glenoid cavity, allowing for more contact area between the surface of the glenoid and the humeral head. Finally, the muscles of the rotator cuff act to reinforce the joint capsule superiorly, posteriorly, and anteriorly. To demonstrate the function of this joint, our yoga class will cover the muscles involved in the movements of the shoulder joint.
So we're going to start off with welcoming the sun. So we're going to abduct our shoulder joint, moving away from the midline.
Abduction of the glenohumeral joint is the movement of the arms away from the midline of the body in the coronal plane. It involves two major muscles. The supraspinatus lies in the supraspinous fossa of the scapula. This muscle is innervated by the suprascapular nerve. The deltoid muscles sit on top of the shoulder and is innervated by the axillary nerve. These muscles work together, contracting to create this abduction movement.
And then back down, adducting back to the midline.
Adduction of the shoulder is the movement of lowering the arms down and in towards the midline of the body. This movement is stabilized by the coracohumeral ligament and is limited by the superior glenohumeral ligament. The muscles involved in this movement are: the subscapularis, which originates from the subscapular fossa, inserts into the lesser tuberosity of the humerus and is innervated by the lower subscapular nerve. The coracobrachialis, which originates from the coracoid process of the scapula and inserts into the anteromedial surface of the shaft of the humerus. This muscle is innervated by the musculocutaneous nerve. The teres major, which originates from the inferior angle of the scapula, inserts onto the bicipital groove of the humerus and is innervated by the subscapular nerve. The latissimus dorsi, which originates from the lumbar and thoracic spine, is inserted into the bicipital groove of the humerus and is innervated by the thoracodorsal nerve. The long head of the triceps brachii, which originates from the olecranon process, inserts onto the scapula and is innervated by the radial nerve. The pectoralis major, which originates from the anterior aspect of the clavicle, inserts onto the bicipital groove of the humerus and is innervated by the medial pectoral nerves. All of these muscles contract to draw the arm downwards.
So now we're going to do downward dog, and we're going to be focusing on the forward flexion of our shoulder joints. So bringing our hands forward to the mat, walking our hands out and stretching.
Shoulder flexion occurs as the arm is moved anteriorly or raised out in front of the body from the anatomical position. The coracohumeral ligament acts to stabilize the joint while limiting the flexion movement. The main shoulder flexors are the pectoralis major and the anterior deltoid. Shoulder flexion also involves the short head of the biceps brachii, which originates at the coracoid process and inserts onto the radial tuberosity, along with the coracobrachialis muscle. The biceps brachii and the coracobrachialis muscles are both innervated by the musculocutaneous nerve.
So now we're going to be doing the shoulder extension stretch. So grab your hands behind your back, move your torso towards your legs and stretch and bend, focusing on that shoulder extension.
Extension of the shoulder occurs when the distal end of the humerus moves posteriorly or backwards in the sagittal plane from the anatomical position. 4 major muscles cross the posterior aspect of the glenohumeral joint and contract to allow this action. The action is limited and stabilized by the coracohumeral ligament. The extensor muscles include triceps brachii, latissimus dorsi, posterior fibers of deltoid, and teres major.
So now we're going to do the Glenohumeral movement, or as Australians call it, the cow face pose. So we're going to reach one arm over and the other arm under and interlock our fingers. And you'll be able to tell that our left shoulder is internally rotated and our right is externally rotated.
The shoulder joint can rotate in both a medial and lateral direction. To perform the cow face yoga pose, the humerus of the upper arm must be externally rotated, whilst the humerus of the lower arm is internally rotated. The infraspinatus muscle, which originates at the infraspinous fossa of the scapula and inserts at the greater tubercle of the humerus. It is innervated by the suprascapular nerve and is supplied by the suprascapular and circumflex arteries. The teres minor muscle originates at the superior portion of the lateral border of the scapula and inserts at the greater tuberosity of the humerus. It is innervated by the axillary nerve and is supplied by the subscapular and circumflex arteries. Internal rotation of the shoulder joint involves rotating the humerus on the glenoid in a medial direction. Internal rotation of the humerus is limited by the inferior glenohumeral ligament. 4 main muscles act to produce internal rotation of the shoulder joint. These muscles are latissimus dorsi, pectoralis major, subscapularis, and the teres major muscles.